Hi, this is Dr. Uliat Ali, ENT surgeon, District Hospital Kargil, Union Territory of Ladakh. Today I'm going to talk about a dire medical emergency the world is going to face in the near future. Declared by the WHO as one of the top 10 medical emergencies, it is antibiotic resistance. As we have seen living the corona pandemic for the last 3 years, how important is the health of people? People have lost their jobs, people have sacrificed their land, people have sacrificed their whole belongings to preserve their health. Even governments have sacrificed their whole economies, their whole setup. Governments have invested everything in the field of healthcare to preserve the health of their public. Large business houses, organizations have shut down. They have invested everything to develop vaccines, to develop protective gear, to develop medicines, to help people preserve health. By this, we can understand the importance of our own health. Only a healthy society can be a prosperous society. Only a healthy society can achieve economic progress and progress in other walks of life. To maintain a healthy society, we need to fight one more dire medical emergency, which is staring in our face, which is threatening to wipe humanity out of the face of Earth, which can even make our species extinct. It's antibiotic resistance. Antibiotics, as we all know, has been the backbone of healthcare in all these years. There was a time before the year 1928 when there was no antibiotic in the world, called the pre-antibiotic era. In those times, a minor infection on the skin, a minor cut on the limbs, on your fingers, a minor infection in the throat, when a minor infection in the sinuses used to take people's lives because there was no antibiotic to fight off the bacteria. The bacteria used to spread to the whole systems, whole body, and used to take people's lives. There were instances when a small injury on your limb got infected and the whole limb used to be cut off so as to limit the spread of infection to the whole body. Now, after the year 1928, when the first antibiotic was discovered, there was a flood of developments of antibiotics. Lot many antibiotics were discovered, and by this we lost the importance of antibiotics. We used to treat antibiotics as like it will be there forever. We used to we started using antibiotics indiscriminately with so much disdain that I am afraid in the near future can come a time when we will be left with no effective antibiotics against even the common bacteria. Again, we will land in the same troubling situation. Again, we will land in the pre-antibiotic situation. As estimated by the World Health Organization, if we continue using antibiotics like the way we are using these at this moment, by the year 1950, by the year 2050, a time can come when we will be left with no antibiotic, called the post-antibiotic era, and humanity as a whole race, humanity as a species will face extinction, will face serious issues in existence. So it's our responsibility to preserve antibiotics for the use of our future generation. If we don't preserve antibiotics for the use of our future generation, or in our future generations are left with no antibiotics, it's like committing a crime against our own species. It's like waging a war on our own future, on our children's. It's like waging a war on our grandchildren's. So at this moment we haven't reached a moment where we can't return. There's still scope of return. There is still scope of preserving antibiotics if we mend our ways and we start using antibiotics judiciously. The situation we have reached, it's not the fault of any single society, any single group, or only the general public. It's not the fault of only the healthcare providers. It's not the fault of only the medicine dispensers. It's the fault of all of us. Even the doctors, even the local pharmacy shops, even the medicine dispensers, general public, everybody is involved in in making us reach this situation of antibiotic resistance. Because what happens these days, when somebody has a viral infection, when somebody has a viral pharyngitis, or when somebody has a fever, they just go to the local chemist shop and say, give me some amoxicillin, give me some azithromycin, give me cefixime, and the chemist shop happily obliges because it's business which is running, it's his business is running. That's why he just happily gives the antibiotic, and the patient consumes it for 2 to 3 days, don't even complete the course. And and when he feels better, he thinks, yeah, because of the antibiotic I'm treated. But what happens when you take antibiotic without indication, when you take antibiotic in a viral infection? Because most of the most of the upper respiratory infections that happens is because of viruses, and people are taking antibiotic to treat the same. So when you take antibiotic without a bacterial infection, when you take antibiotic uh, for not for the adequate duration and not with the adequate dose, the bacteria can develop resistance. The bacteria will sure short develop resistance. The next time the antibiotic is used, the bacteria will not be killed by the antibiotic. In fact, the bacteria will kill the patient. So it's a request to all the general public to never buy antibiotic by their own. Never buy antibiotic over the counter. You can buy paracetamol, you can buy painkillers, you can buy anti-cold tablets, but never buy antibiotics by your own without a prescription of a doctor. And it's a request to all the local pharmacies and the medicine dispensing shops, the chemist, and the online medical dispensers to never sell antibiotics over the counter. Never sell antibiotics by your own without the prescription of a doctor. Only sell antibiotics when the patient comes with a prescription from the doctor. And it's the responsibility of every healthcare practitioner, the doctor, to prescribe antibiotics judiciously. Only prescribe antibiotic when it is clearly indicated, and only prescribe that antibiotic which is suitable for the local sensitivity pattern. First of all, we should not prescribe antibiotic without culture sensitivity report. But there are some situations when the culture sensitivity report is delayed and the patient's health is compromised. We need to prescribe antibiotics, or in some places where the culture sensitivity facility is not available, so we have to prescribe antibiotics, but prescribe only that antibiotic which you think is enough for to fight off the bacteria. Don't indiscriminately prescribe broad spectrum antibiotics. Only prescribe antibiotic for the adequate duration, only in the adequate dose, only the adequate antibiotic, not more than that. Try to use antibiotics as minimum as possible. This way we can prevent resistance. This way we can preserve the antibiotics for use in for the long term in the future generation. So it should be a very coordinated approach from the general public, as well as the pharmacy shops, the medical dispensers, and the most importantly the healthcare practitioners, the doctors, to limit the use of antibiotics as much as possible. Only use antibiotics when there is clear indication, and try to do the culture sensitivity report and prescribe antibiotic as per the culture sensitivity report. And also keep in mind the local sensitivity pattern. When the culture sensitivity is not available, prescribe antibiotics based on the local sensitivity pattern and only the adequate duration only. This way we can preserve antibiotics, because antibiotics are very precious. It's even precious, it's more precious than gold, it's more precious than diamond. It's the most precious belonging of the whole human race. Antibiotics have been life saving. Antibiotics have saved human race. So for our future generation, for our own good, for the preservation of our own species, we need to preserve antibiotics. So it's a hand-folded request. It's a hand-folded request to all of you, to doctors, to pharmacists, to the general public, to limit the use of antibiotic. Only use antibiotic when indicated, so that we can preserve antibiotics for our future generation. Thank you very much.